live to the White House for comments on health care by President Obama.
Thank you very much. Thank you. Please, everybody, have a seat. Oops. Thank you so much, all of you, for joining us today. And I want to thank Julie, Barbara, Roland, Stephen, Renee, and Christopher standing behind me. Physicians, physician assistants who understand how important it is for us to make much-needed changes in our healthcare system. I want to thank all of you who are here today. I want to especially recognize two people who have been working tirelessly on this effort. My Secretary of Health and Human Services, Kathleen Sebelius. As well as our quarterback for health reform out of the White House, Nancy Endepro. We began our push to reform health insurance last March in this room with doctors and nurses who know the system best. And so it's fitting to be joined by all of you as we bring this journey to a close. Last Thursday, I spent 7 hours at a summit where Democrats and Republicans engaged in a public and very substantive discussion about health care. This meeting capped off a debate that began with a similar summit nearly 1 year ago. And since then, every idea has been put on the table. Every argument has been made. Everything there is to say about health care has been said, and just about everybody has said it. So now's the time to make a decision about how to finally reform health care so that it works, not just for the insurance companies, but for America's families and America's businesses. Now, where both sides say they agree is that the status quo is not working for the American people. Health insurance is becoming more expensive by the day. Families can't afford it, businesses can't afford it, the federal government can't afford it. Smaller businesses and individuals who don't get coverage at work are squeezed especially hard. And insurance companies freely ration health care based on who's sick and who's healthy, who can pay and who can't. That's the status quo. That's the system we have right now. Democrats and Republicans agree that this is a serious problem for America. And we agree that if we do nothing, if we throw up our hands and walk away, it's a problem that will only grow worse. Nobody disputes that. More Americans will lose their family's health insurance if they switch jobs or lose their job. More small businesses will be forced to choose between health care and hiring. More insurance companies will deny people coverage who have pre-existing conditions, or they'll drop people's coverage when they get sick and need it most. And the rising cost of Medicare and Medicaid will sink our government deeper and deeper and deeper into debt. On all of this, we agree. So the question is, what do we do about it? On one end of the spectrum, there are some who suggested scrapping our system of private insurance and replacing it with a government-run healthcare system. And though many other countries have such a system, in America, it would be neither practical nor realistic. On the other end of the spectrum, there are those, and this includes most Republicans in Congress, who believe the answer is to loosen regulations on the insurance industry, whether it's state consumer protections or minimum standards for the kind of insurance they can sell. The argument is that that will somehow lower costs. I disagree with that approach. I'm concerned that this would only give the insurance industry even freer rein to raise premiums and deny care. So I don't believe we should give government bureaucrats or insurance company bureaucrats more control over health care in America. I believe it's time to give the American people more control over their health care and their health insurance. I don't believe we can afford to leave life and death decisions about health care to the discretion of insurance company executives alone. I believe that doctors and nurses and physicians' assistants, like the ones in this room, should be free to decide what's best for their patients. Now, the proposal I've put forward gives Americans more control over their health insurance and their health care by holding insurance companies more accountable. It builds on the current system where most Americans get their health insurance from their employer. If you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor. I can tell you, as the father of 2 young girls, I would not want any plan that interferes with the relationship between a family and their doctor. Essentially, my proposal would change 3 things about the current healthcare system. First, it would end the worst practices of insurance companies. No longer would they be able to deny your coverage because of a pre-existing condition. No longer would they be able to drop your coverage because you got sick. No longer will they be able to force you to pay unlimited amounts of money out of your own pocket. No longer will they be able to arbitrarily and massively raise premiums like Anthem Blue Cross recently tried to do in California. Up to 39% increases in 1 year in the individual market. Those practices would end. Second, my proposal would give uninsured individuals and small business owners the same kind of choice of private health insurance that members of Congress get for themselves. Because if it's good enough for members of Congress, it's good enough for the people who pay their salaries. The reason federal employees get a good deal on health insurance is that we all participate in an insurance market where insurance companies give better coverage and better rates because they get more customers. It's an idea that many Republicans have embraced in the past, before politics intruded. And my proposal says that if you still can't afford the insurance in this new marketplace, even though it's going to provide better deals for people than they can get right now in the individual marketplace, then we'll offer you tax credits to do so. Tax credits that add up to the largest middle-class tax cut for health care in history. After all, the wealthiest among us can already buy the best insurance there is, and the least well-off are able to get coverage through Medicaid. So it's the middle class that gets squeezed, and that's who we have to help. Now, it is absolutely true that all of this will cost some money, about $100 billion per year. But most of this comes from the nearly $2 trillion a year that America already spends on health care, but a lot of it is not spent wisely. A lot of that money is being wasted or spent badly. So within this plan, we're going to make sure that dollars we spend go towards making insurance more affordable and more secure. We're going to eliminate wasteful taxpayer subsidies that currently go to insurance and pharmaceutical companies. Set a new fee on insurance companies that stand to gain a lot of money and a lot of profits as millions of Americans are able to buy insurance. And we're going to make sure that the wealthiest Americans pay their fair share on Medicare. The bottom line is our proposal is paid for. And all the new money generated in this plan goes back to small businesses and middle-class families who can't afford health insurance. It would also lower prescription drug prices for seniors, and it would help train new doctors and nurses and physicians' assistants to provide care for American families. Finally, my proposal would bring down the cost of health care for millions, families, businesses, and the federal government. We have now incorporated most of the serious ideas from across the political spectrum about how to contain the rising cost of health care. Ideas that go after the waste and abuse in our system, especially in programs like Medicare. But we do this while protecting Medicare benefits and extending the financial stability of the program by nearly a decade. Our cost-cutting measures mirror most of the proposals in the current Senate bill, which reduces most people's premiums and brings down our deficit by up to $1 trillion over the next 2 decades. Brings down our deficit. Those aren't my numbers. Those are the savings determined by the Congressional Budget Office, which is the Washington acronym for the nonpartisan, independent referee of Congress in terms of how much stuff costs.